how does this start? Because we do have a historical, okay? So I will read to you the IPA mandate, which will inform you sort of in a very basic way about the philosophy and the objectives. And then we will see why we are doing, how we are implementing it and why we are implementing it in that particular way. If I sit down, is that all right? Are you all having a view? Yes? Yeah. Okay. So this one I will read. It is just one paragraph, but every word matters. So I just want to make sure that we get all the words. This is the mandate from the IPA board, 2014. Okay, that's when it was. They came to. That's the last IPA presidency and administration. Stefano Bolognini, Alexander Billinghurst. Okay, that's their vision. So, in the historical decision of the IPA board inaugurating the IPA, at the time called Encyclopedic Dictionary, now it is IR, Inter-Regional Encyclopedic Dictionary for Psychoanalysts Task Force, the mandate was, there are many excellent dictionaries of psychoanalysis, but the IPA, in parentheses, and in our opinion only the IPA at this time, has the human resources, the scientific potential, and the cultural articulation to create an extraordinarily complete and advanced one that is truly representative of the various theoretical trends and schools in the psychoanalytic world. The goal is to provide all psychoanalysts and all psychotherapists who work psychoanalytically with a truly international and up-to-date tool for consultation and reference of superior quality and wide scope, which represents both the trunk and the branches of the psychoanalytic tree as it has grown from Freud to the present time. The final product is not necessarily a work of integration, but the broad, complex representation. That is very important. We are not forcing integration. The convergencies and differences in the conceptualizations of various schools and areas would be clearly described in full respect to their cultural theoretical specificity and their historical and cultural background. Now, what does that mean in terms of the... Hey, yes, this is us. This is Dr. Balsam, Rosemary, come on, right in. Okay, now, what that means in sort of as far as the philosophy and the practical then execution of that. Drishti? Yeah, thank you. Is that now dictionary is understood as basically explanation of the term, okay? Encyclopedic part actually brings in the evolutionary, the roots, the evolution, the cultural context, and basically the wider scope of how each concept has evolved. Where does it possibly started? So there are, for instance, concepts which many of them start with Freud, right? And even sometimes in the pre-analytic period, so to speak. And many of them start with philosophers, like with the intersubjectivity. You cannot quite start without also naming certain philosophical roots, right? So it is a really wide scope, and sort of encyclopedic part is stressed. That was a very important part of the mandate. Okay, so it's not just a terminology explanation of the terms as any excellent dictionary might have. Plus, we, as for how this was implemented, also then the focus was on the dimension of different ways how psychoanalysis works, how people think, those who do psychoanalysis with the IPA world, so to speak, globally, what are the concepts they are thinking, as they work, and what informs, what kind of conceptual base informs their work most. Okay? Now, this was originally a real grassroots collection of concepts. This was not A, B, C, D, up to Z. What we would select were the important concepts to write about. Each region, all three geographic IPA psychoanalytic cultures, North America, Europe, and Latin America, gathered about 25 consultants, the original consultants, who were from different geographic locations, but also different schools of thought, as much diversity as possible. Now, each continent implemented it slightly differently, how they went about it. For instance, Europe, where you have a lot of countries, so they would take people from different countries. Similarly, in Latin America, although there was more concentration on Argentina, for instance, because there are more psychoanalysts, but also Brazil, Rio de Plata, etc. Now, North America had a particular approach because what belongs to North America geographically is US, Canada, and in a weird way, Japan, right? Because this is the only fully accredited so far IPA Psychoanalytic Association, so we have also Japan, which is wonderful because without them we would not have a concept of men, which nobody until that time, until we wrote about it, outside of Japan, didn't much know about. Now, so very basic methodology crash course now. How does that philosophy get put in place? So first we had those 25 consultants in each region who would be asked two questions, which we had. Excuse me. Is he taking orders? I'm very sorry. Is that for the food orders?
No, for electricity.
What?
Electricity.
Electricity.
That we don't have here.
Very sorry. Two main questions, and I am some of you may find it repetitious, but it really informs us at every part of our work. You know, it is so important to know really that whole context. Two questions. First question, and that was standardized. That was actually on every continent this was being asked. Which concepts inform your thinking and work most? And then which concept or concepts you believe originated in your psychoanalytic culture, or which concepts resonate with it in some special way. All right? So then we got responses, which we rated in terms of putting them into clusters. So let's say we got ego concepts, object concepts, then we got object theories, object relations theories, then we got relational theories, then we got body ego, let's say. So we formed clusters, right? So from out of those clusters, or let's say unconscious logic, or the unconscious, or unconscious processes, right? So that goes under the unconscious, right? Then let's say a variety of partial conceptual terminology around ego was under ego psychology. Various partial, different kinds of objects flying around, or part objects, self-objects, etc., went under the object relations theories. And then, of course, we had self-transference, self-object transfer. So that goes under transference, right? So what is interesting is that in North America there seems to have been more very much clearly diverse lines of how different clusters, conceptual clusters, were engaged from particular, it already became so clear that there are different ways how to look at the concept, which was very then organically, naturally translated into forming conceptual teams, right? So then we have those concepts which occurred most frequently on every continent, on all continents somehow together. Let's say the unconscious, or transference, countertransference, projective identification, containment. They were put into those first 5 or 6 which we started writing on, yes, all continents. Then there were concepts which each continent thought, of course, resonated most with them or originated with them. And there was, for North America, for instance, there was enactment. But, surprise, Latin America also has enactment as what resonates with them very specifically. So this becomes a concept then which we both are writing on by regionally. Each region writes their own separate draft. Then they get merged, and then Europe sends a response draft. And this is one way how we are then working interregionally, okay? With, for instance, the unconscious, as it is called the, in parentheses, and then unconscious. Now, that came first or second, okay, in terms of frequency everywhere. That starts out, such a type of a more general universal concept starts out from 3, each continent writes so-called original draft, okay? So then we had the first batch of the concepts, either 2 regions mentioned together as very frequently occurring. So there is the bi-regional draft, written together from 2 original ones, and the third region writes the response. Or if it is more universal, all 3 regions write their own regional draft, and then it gets merged into a tri-regional. Now, in the end, or one region, let's say we have AME, North American Japanese, very regionally specific. No other region comes up with that. They write it, the Japanese Psychoanalytic Society writes it, then we get it to be interrogated by our specialists, Nobuko, Linda, on that particular concept, so it gets put through the whole mill of the consultants from North America who review the write-up if it is put in a sort of meaningful context of the world psychoanalysis, and then it gets written also tri-regionally, okay? Now, that means one original draft, and then Europe and Latin America are reviewing. Do you have anything to add? Well, as far as AME goes, not much. So they are just asking questions, then questions get answered back by the original country and the society, and then it goes into the tri-regional merger and gets printed. So you have AME here. Similarly, you will have from Latin America such a not very much worldwide known concept, Lieberman's theory of communication. Okay, so they write it. I read it several times. A lot of the editorial questions, inquiries, they have an input. We then put it together, and there is one regional draft, very specific regionally. 2 other regions just ask questions, and that gets implemented, answered, considered, and we have a tri-regional entry of that now. So that we are proceeding then from each region towards, as the regional draft gets written by the consultants who mentioned that concept as prominently on their mind, then gets reviewed by the regional review, which consists of all the consultants and contributors, and then it goes into the tri-regional work, okay? The co-chairs, I for North America, then the co-chair in Europe, Anna Jämstedt in Sweden, and in Latin America now they have an exchange of co-chairs. It was Elias Rocha Barros, and now it's going to be most probably Abel Feinstein. So we are the ones who then coordinate the whole flow and write up of the regional drafts, and then also we divide among ourselves who coordinates what on the interregional level. Usually the region who wrote the original, one of those that wrote the original draft, maybe who finished first, is going to be coordinating also interregionally, which for better or worse is usually us here, because we seem to be rather very productive. I just wanted to also thank you all for that, because we are doing an amazing job. Now, what happens is that very specific to North America, and I can say that because I also was already coordinating the interregional concepts, so I know what I am getting from Europe and what I'm getting from Latin America. Very specific for North America, and I think we could actually quite give ourselves a credit, because American psychoanalysis did have a rather complex development. It is a sort of implemented in life, in a real work, without me telling anybody. Inclusion on a merit. Okay? This is how then, let's say, 5 consultants form a team, and they say, hey, we still need that perspective, or this perspective. This is not represented here. Can we go out and get additional expert contributors? This is how then additional expert contributors get invited in, okay? And then they become part of the whole team, which only gains, right? It becomes like the more perspectives, the more views on that particular concept, the better. Because what then we start learning, and this is already one of the findings, is that there are internal connections between different schools of thinking, that there may be certain particular aspect very much stressed, and that one is then in the forefront of how the school thinks. But there are many internal connections which one would not otherwise be able to see once you actually engage as many perspectives as possible, right? So that is actually quite a pioneering finding. I think the schools are very different sometimes on a surface, and internally there is a much more of a kind of current, common undercurrent, which organically is part of it. It's not that it's forced in any particular way. But we wouldn't know that unless we examine all these different dimensions, and different schools then become kind of dimensionally enriching the field, right? That's where we have the trunk and the branches, and it's all connected. But this was Bolognini, who I think English is about his 7th language, and so he just thinks of the word, and it actually is getting confirmed organically. Yes, everything is interconnected there. This is where we would be until we start talking about specifics, and you also have worked specifically on those concepts which are now here. Some of them already finalized, some of them in the interregional work right now, which I'm doing with the object relations, which is a mega concept. Some of them are regionally finalized, the specific contributions of American psychoanalysis, for instance, the intersubjectivity and ego psychology. And now they will be going into the interregional work. And we will be talking more specifically about your work, your observations, your experiences as consultants and contributors. But before then, I want to ask, anybody has any questions, thoughts about what you heard now? The kind of general process, is it understood?
I've two questions. They are actually related. One, is there a risk that because nobody raises an issue, a certain concept be left untouched?
Oh, that's a wonderful question.
Risk of non-completion. And connected so that perhaps there needs to be a process of putting it all together in terms of looking whether really it's all there or not. Second, and this has only more recently gotten my attention, we are under pressure to carry out research on the effectiveness of psychoanalysis. At one point, we'll have to carry out empirical research in that regard. Mm-hmm. And that will mean definition of our interventions, our technique. So there will be pressure on us to have an integrated theory of technique and of technical interventions. In my Institute of Personality Disorders, we are carrying out research on the effectiveness of psychoanalytic psychotherapy. And as part of this, we ran into the need to really look into the entire armamentarium of psychoanalytic techniques. And we first discovered that there is no textbook no integrated textbook on psychoanalytic technique. Each school has its own, but there's no general textbook, which is amazing after 100 years of psychoanalytic education. But we felt that we could, for practical purposes, put together psychoanalytic technique and start classifying it. And so this then made me think that this encyclopedia might be a magnificent opportunity of constructing such a complete registry of all psychoanalytic interventions, their mutual relationship, and facilitate the development of a textbook of psychoanalytic technique. It may come almost automatically. Mm-hmm. So I wonder, would it be helpful to to select all definitions that deal with interventions?
I think that's an excellent idea, actually.
And see whether we can
operationalize
can have an integrated view, so all technical intervention of all the continents and all the schools are mentioned and can be defined and can be mutually defined, or whatever is controversial can be defined. And I think that would be a tremendous task for the future, although shockingly the psychoanalytic institutes all over the world are not interested in doing that. I think there is a general problem in our teaching of technique all over the place. So we would be ahead of time.
I think that's such an important issue, actually, because you do have, obviously, this would be a reservoir of kind of, you could say, up-to-date knowledge. There are, in one book, right? Now, there are theoretical concepts, there are metapsychological concepts, right? There are different areas, actually, from which these concepts are gathered. And then there are clinical concepts. And in the clinical concepts, very clearly, you have particular ways how specific conceptualization, let's say, is unearthed in the work. And you will have point by point, and I think that is exemplified actually, for instance, with enactment. Let's try to find enactment here, and I will give you an example. Yes? Okay. And it's also coming up, I think, in the memory concept, memory, which is the anaphylaxis. But let's see, Latin American, and then we have it also in the containment. You have step by step, almost operationally defined how they work with the concept. Now, we could look at it here, and we have always clinical relevance there, right? And each region obviously approaches differently. Each author, each school approaches it differently. Latin America. Okay, there is a certain taxonomy, as they call it. And you can look then at the taxonomy of the various concepts, but you will have, again, I mean, 1, 2, 3, 4, 5. It goes steps, how you are engaging the concepts clinically. The more, of course, the concept belongs to the clinical concepts, the more there will be focus on that, what you are talking about. But I think what you are also talking about then is to basically cluster together the technical conceptualizations, pick up on some aspects of the clinical utility, for instance. Some of the concepts have the subchapter, contemporary clinical utility. And what is surprising is that that probably would not be such a hard work, because then you would just put it together and you would then operationalize as much as possible, but without losing the richness and the meaning, of course. And that might be, that might be quite a contribution. I think that would be very important. We might then talk more about that specifically, how we might proceed. What is interesting? Yeah, go ahead.
A lot of this work has been done in the dictionaries, right? So a lot could be begun. We could begin to draw from those dictionaries in PEP.
You mean the dictionaries that we do have now?
Yes, yes. As starting points for the clinical concepts, not the operationalization of them, not the operational definitions, but the clinical definitions, which would begin to show what's needed to be filled in.
Well, you already have an operational manual, right? I downloaded it. It's about 150 pages, right? It's, if I'm not mistaken, maybe you can contribute part of that.
I'm sorry.
Isn't there an operational manual that you're using?
Yeah, I'm thinking, a manual of psychoanalytic technique.
Yeah, you already have it.
We don't have that.
No, we don't,
And there's even strong opposition to do that. I mean, particularly the French psychoanalysts feel that the concept of technique is already a mechanization. We only have a psychoanalytic method, not a technique. But I think it would be, in spite of that, it would be helpful to have such a...
Well,
it's such an incredibly complicated notion when you take the variety and the plurality of theory. That how could there be one? How do you imagine one document that would encompass such a vast area? How do you operationalize something like the people who believe that there's something more than interpretation, for example? All the interactive elements, and it just blows my mind. The idea that you obviously have a notion that could be encompassed, so I'm extremely interested.
Well, there is a book about that already. Van McBulkan wrote a book 2 years ago called Psychoanalytic Technique Expanded. in which he actually goes through techniques for different types of disorders. It's not nearly as comprehensive as what you're suggesting, but it's a beginning, and he does list all these things. So there are some things out there that attempt to do
Yeah.
that.
You know, the last one that I think of is like Grayson or something. You know, in the
Yeah,
old
the
days,
old time was
when
Grayson
life used to be
60s.
simple.
Right.
But this meeting has, Rosemary has gone over that structure. There is a structure in place to begin to feed these concepts back to the original theories and to get feedback across different perspectives. You have a great opportunity here to start creating operational definitions on one level for researchers and clinical data on another, or clinical definitions on another. And you can get agreement across regions the way these concepts were done.
What is interesting is that when you, let's say, have a book on techniques, because it does exist, right? But it usually is not operationalized. Usually it comes from one or maximum 2 points of view, basically, right? This is how Ralph Greenson would work, for instance. Or this is, when you have a transference-informed psychotherapy.
Yeah.
We have managed to, took us years, but we have a manual of psychoanalytic psychotherapy specifically geared to severe personality disorders. That is, and that we work on. It is now the 3rd edition, and so we went in to look into psychoanalytic technique, and I have recently written a series of papers that's going to be published in a book presenting an overview of psychoanalytic technique. What are the essential techniques, what are the secondary ones, and there is room for what is not interpretation, as well as for all clinical phenomena. Whatever happens while we see patients has to find a place. And as we define the basic concepts, we find out what doesn't fit and how it can be put in. We are not used to thinking that way. I'm aware of that. Manual sounds like a very rigid. What do you do now? But a contemporary concept of treatment manuals sees it as guiding principles that includes all the principles that then can be applied very flexibly and intuitively by the therapist, by the analyst, while outside observers can still tell whether the flexible way in which this is done fit within what the defined technique or not. That's what we need for research. And we may be really very well placed to do that.
Yeah. I am just as you were talking, just as you were discussing it, I am looking at the next concepts, right? So I said that there were several of the steps how we identified the concepts. Basically, we went down the line from the most frequently occurring everywhere, down the line. Then the second batch was conflict, object relations theories, and Nachdenklichkeit. That was the French had that, this lead concept. And the other regions had it enough frequently so that we then wrote on that. So those were the three, which is in our usually balance here. It would be the deferduction or afterwardsness in English. Now, and then each region again had their own regionally specific, like we had self, intersubjectivity and ego psychology, and then the Latin Americas had transformations, maddening objects, which then got put under the object relations. But then there is the third group, and the third group is free association, building psychic structure, and that would be internalization, representation, symbolization. This is on your entries, okay, piece, which you all have.
That's what you sent us, right?
It is the interregional entries finalized. That's how it starts, okay? Did you distribute it? Yeah, okay. So now, on the new concepts, actually are very much in line with what you're talking about. Free association, building psychic structure, internalization, representation, symbolization, infantile sexuality, that's the French, and regression.
Yeah, regression would go in there, wouldn't it?
Regression is there.
Yes.
Yes, right. So what it appears again is that as we go down the line in terms of frequency, that very organically, while starting more with the, let's say, the metapsychology, with the unconscious, but then already going towards more clinical concepts and clinical theories like transference, countertransference, and enactments, right? There we go for the also interactive, sometimes non-interpretive modes. And then we have ego psych, then we have intersubjectivity, again, more theoretical conceptualizations, and afterwards we go into all the kind of technical, basically not just the technique, but the way how all that gets comes up in real clinical interactive work, right? The interpsychic and interactive, how does that also interrelate? And you have it for in the next 5 conceptual areas, and there already, I think we are basically going towards then how all that can start to be. It's already closer to the operationalization, right? How much with, let's say, certain diagnostic categories we would be using the free associations, how much they are really free, how much that becomes more loosened up thinking versus disorganized thinking, right? That would be a different way of, but certainly each school will again be informing as to how they are conceptualizing it and working with it. Under what conditions, when, with which patient. But I think that it is probably, you see, when we would start, just taking from dictionaries, I think, just the terminology, we don't get the substantiation of the richness, which goes with the encyclopedic kind of global reach of that. But if it is coming out with the French participation, talking about French, if it is coming out of that whole fully informed, fully represented base, then we could find ways how it even for French will make sense. French, that's a very interesting, by the way, continent of thinking. It's its own universe. But also they are somewhat always interacting with the particular cultural milieu where the school of thought is developing, right? So in France, you have 1 or 2 actually camps, Lacanians versus never Lacanians, which is Lagache versus Lacan. That was the beginning. But then you have Belgians, right? Which certain concepts there, which are akin to countertransferential enactments, were not known because they were only published in French. Then that Jacobs and team wrote on enactment in the International Journal, a review, and then the Belgians got very offended, the French, how come we are not cited here? We are doing something very similar. Yeah, but because you didn't bother to come out with that, to let anybody know besides your kind of an isolated sphere. So now we are interconnecting it. Okay, we're translating things which were not translated from Spanish, from Portuguese, from French. And that's where you do get then some sort of a softer area of boundary, that it's not such a frontier, there's no big wall sometimes. Once you start going more in depth how these people are thinking, because then it appears, well, yeah, this is really similar. And then they would write 40 pages on how they work with it, which already is just a step from operationalizing. So they may not call it that. They may not say this would be a manual, but they are actually very close sometimes, approaching illustration. How does this come up in the session? And that is not so different. Although there will be big metaphysical, metapsychological words behind it, drives, for instance, right? So you will have a drive-informed enactment, yes, but it is still practical. And then how do certain, let's say, interactive moments then emerge in this, and that would be
different perspectives approach. That's really
and that is finalized already very generally, and you will see the differences. When you look at the encyclopedia, then you will see the differences, but they are coming to the clinical process. Even from the most metapsychological, for instance, concept, you can take the unconscious or you can take Nachdenklichkeit, right? First of all, it was not possible to put together a European team. It was written by one person because the three of them got into quite a strife. So basically, it is only Chevret, right? Now, fortunately, we really, I told him, you don't have to write about the others too. So it was included. But even with Nachdenklichkeit, if you look at it, you will have already, you have a taxonomy there. Now that comes from Apri, who is North American, Bionian, Freudian, putting that together. But it is a taxonomy, how you proceed, 10 steps and out of Eva Volkan, intergenerational transmission, big concept, theory, right? Sounds esoteric many times, but there is a taxonomy. And then how does it emerge in the transference, counter-transference, and how you interrogate it, how you approach it, how you work with it dynamically, analytically. So I think that is a very important issue, that ultimately that is where we are going, right? But the richness needs to be considered, and let's say we have to always stroke the French and say, of course that this is fully connected with the deepest strata of how we think about, how we conceptualize theoretically and meta-theoretically. But in fact, then when we are sitting with a patient in the office, there are certain processes which can be explicitly operationalized. How does that deepest strata come up, right? Or how does it emerge? And that already approaches operationalization. It may look differently than if there is an operationalization, let's say, of a particular behavioral concept or cognitive concept. But it will be possible probably to do operationalizing.
It approaches it, and yet it keeps it within the metapsychological frame, rather than creating it sectionally as a technical methodology, which is, I think, really the important thing we can gain from this. It doesn't mean, and I'm talking to the research side of it, not the clinical side of it, because there needs to be a way to put together ideas that can develop reliability and validity coefficients. We need that. But it may not be enough to inform all our clinical work. So we need that as well. But I think the methodology issues are very important to have sectionalized. It's an opportunity.
Yes, and I think that this is actually what you are just bringing up, Art, is the maybe one of very core or essential then contributions of psychoanalysis to even the methodology of psychotherapy research or research on behavioral changes, right? Because for us, the latent and the metapsychological will emerge anyway somehow, but how do we capture it? How do we know it? How we interact with it? And how we effect maybe change, God forbid. Right? But the connection with the latent and how the latent then manifests itself, that could actually be part of that. Because we cannot lose the latent. Then of course we won't have French on board, but we will lose many people. Right?
90% of the room.
That's right, yes. But as long as the connection between the latent and manifest is preserved, it is doable. I would say, French of all, and I've met some rather creative French, so I am not, I see that more on a continuum. That, for instance, when they talk about symbolizations, if you take that as an example, so they are very much in camp of thinking something is not symbolized, but it is symbolizable. And I would use that almost as a hallmark of this kind of also approaching the, maybe we don't have that yet, but it may be doable if we actually get to think also of all that we are now gathering together as a reservoir for this kind of work, that this is where we may need to go also, without losing the richness and the connection with all the metapsychological thought and the deeper strata of
Could I just
mental
respond
life.
to that? Because I think while having as a goal being able to operationalize the concepts in the way that Otto suggests makes perfect sense, I think it would be a mistake to make that goal a limiting factor
Yes.
in the development of the concepts at the
Absolutely.
beginning. That is, to
Absolutely.
target it exclusively to operational would leave out very
no,
important dimensions.
Yes, no, that is so important. We don't have a goal, right? Because the goal, in a sense, is a process of seeing what exists in the world, in psychoanalysis thinking and work. But because we are also, the basic philosophy includes how the psychoanalysts think and work, there is a connection, right? And the work is somewhat informed then by something what we do, right? We think and we do, and the patient has a latent level of how they operate, and the manifest level, how it
To
comes.
go back to your French metaphor, they may not be defined reliably yet,
Mm-hmm.
but they may be definable. And if we can get near that, then we've done something very important.
Yeah, I'm not in any way against getting closer to reliability. I'm just saying that to use that to limit
Mm-hmm.
the
Right.
collection, and let's also recognize that in any clinical practice in the medical field, there are dimensions to the efficacy of treatment that are not operationalized. When you choose a cardiologist, you don't only choose a cardiologist based on how well he follows the manual. Some are better than others in ways that are still not definable within a field like cardiology. So, you know, I don't think we should assume that we're going to, we should set for ourselves a too restrictive standard. That's all I'm saying. What you're pointing out, I completely agree.
I think we need to take that as an addendum, as an additional, very important aspect of the work. That becomes part of the thinking, how we are working on the concepts, or how, look, these concepts have been already gathered, right? What is coming now is just organically the next batch of concepts which are occurring most frequently on all continents. So we cannot shortchange that process. We are ultimately getting through the whole line of all the concepts which occurred at least once. Okay? Now, but if on someone's mind is also how effective this is, all right? That is also a thinking. This is how we think. This is somewhere in the back of our mind. This is part of what we do, right? And we may do that very naturally without even operationalizing it. We may be sitting there and the free associations are coming out, and we are making a decision, clinical decision, in interaction maybe between our pre-conscious, unconscious with the patient's unconscious. What we are going
I
to
agree
find.
with you. You know, I think that's incredibly important, and it introduces, you know, I mean, we've been, see us doing very exploratory work, really, about how all these different regions think, and how, and it has been very surprising and enriching to interact with other people. You know, the South American point of view, that will sort of semi-agree and don't quite, but add yet another dimension that one hasn't maybe thought of before. So you're also bringing out and emphasizing that in order to do this kind of future work, that we might also keep in mind, you know, as we can work with many different levels of integration in our own heads at the same time, that we have in mind, how do we work?
Yeah.
And that, you know, I think I would really sort of, I think this helps to sort of enrich, as you say, to have in mind as you're working on the other level of the exploratory level, to also keep track of if there are any comments from people about how do they do that work. The problem with that, you know, is if you take it, or how seriously to take it in that direction, because inevitably, you know, the obvious place to go if you're talking about clinical concepts is to go to clinical work. And, you know, the introduction of too much clinical work in this kind of exploratory, conceptual exercise, it makes the thing gigantic too, you know. It hasn't been one of the features of the materials that I've seen to date. There are very little in the way of clinical examples. There haven't been so many in the materials that I have seen, so I have to keep an eye out for that. But it just seems like it's extremely worthy and a direction, and I can see where the large geography of this world map can go. But as to our particular tasks at this particular time, when we're still sort of in a very, I think, in a very exploratory mode about how other regions are, how do we, I think that's a big discovery of this, that there are, in fact, connecting.
Yes.
Sort of in this scaffolding, there are indeed connections that some of these schools of thought are not so radically different that we don't know what we're talking about. Sorry.
No, I'm resonating with what you're talking about, and as I am listening, I think the direction of the discussion on some level seems to be going from the specific to connection or generalizable mutuality or connection that exists regionally and interregionally and globally. And I think your work has been going that direction. Many specific culture or regions where certain concepts are utilized and understood, but similar kind of experience exists elsewhere, and somehow or the other, what seems to be kind of common thread seems to come at the end. As I was listening to Eva that was coming through. On the other hand, I think Dr. Kernberg seemed to be raising this issue of how we might be able to utilize something that's general or common to the specifics. And it might go from the specific clinician, the school they went, which school of thoughts and institute you are trained, regions, American psychoanalytic movement, or elsewhere. One movement goes back to more of a general. And what you seem to be talking about is, could we look at something that's kind of common and help the specifics? And somehow I think there's basic conflict or contradiction. I do think each one of us work with very, very specifics. Our clinical work has to be very specific individual, specific therapist, specific analyst with specific training, and so forth. And we are trying to find something that kind of touches us all. And in a way, we are searching for what we can claim together as psychoanalysts. And at the same time, there's this another way of organizing our own thoughts or a way of working that comes from general principle to the specific. So I think there's a kind of general conflict, or something needs to be looked at from both ends.
It can be a very fruitful conflict, actually,
Yeah.
because if you bring it into the mix, then you already are, I mean, as far as the conflict goes, right, or dialectics, that means it's part of that,
Yeah.
right? But it is, again, it's emerging naturally. This is on Dr. Kernberg's mind, this is on your mind.
I think that if there are different or controversial ways in which the same concept is used in different countries or
Yeah.
contingencies, that can be included in the definition, trying to find out what makes it a common concept, and then in which way are there variations.
Yeah.
And are unresolved open questions. I think that's perfectly appropriate. As you pointed out, it's a stimulus for research.
Yeah.
And then regarding some concepts, but those, particularly those that deal with technique, an issue of operationalization may be included. For example, you mentioned symbolization. that brings up immediately patients whom we consider having difficulty in symbolization. How do we deal with that? That can be included in that definition.
Yeah.
Symbolization, what about when it's not there? Another example, interpretation. Definition of interpretation. Does the technique vary with seriously ill patients? It's controversial. Some people think very sick patients don't accept interpretations. Others, to the contrary, think that that's a very important area.
It's a claim. Yeah.
Then psychic reality. This brings up the issue of patients who cannot contain certain basic conflicts as part of the psychic apparatus. Yesterday there was a lot of discussion in one of the panels what happens with psychosomatic patients where the French feel that there is no mental representation. So both under mental representation, such condition may be mentioned, and under psychic reality.
Yeah.
In other words, the limits where the concept doesn't apply or enters into some clinical problem or controversy. If that is included, then it will enrich the definition, and at the same time will provide elements that if all the technical issues are put together, it will move in the direction of an integrated theory of technique, but the way we don't have it.
And so there you have the new concept, one of those that are coming up, right? The symbolization of building psychic structure. And there you have symbolization of representation and internalization. So you have all that coming now as new concepts, as will be, and there are these teams. Please, if somebody is interested, put also your name, email me, I'll add you to the team. And so, for instance, that would already be going in that direction. Again, organically, right? But that would be one of the aspects.
Yeah. I have a question. As you collect the different theories, certain theories, of course, lend themselves to certain types of interventions. So if you're using conflict theory, you're going to be looking at interpretation of defense and compromise formation. If you're using object relations theory, you're going to be using other interventions about internal representations. And if you're using Lacanian theory, which I don't profess to know much about, but I know they have odd techniques where they end the session and throw the patient out after 5 minutes or something. They have some French word for it.
Well, that was just Lacan as a unique.
What I'm getting at is that...
Right, they call it.
What's it called?
I think, well, in English they call it the cut, or
The cut. There's a
I
word
don't
for
know
it
what
in
the
French.
French, the French word is.
But
yeah.
No, there's some other
Oh,
Latin.
fancier word.
Yeah. But I think maybe as we collect the different theories, there will be some implication about what type of techniques would be used with that theory as a beginning before you begin to try to collect statistics about it.
Yes, and well, let's say you have, I believe, the piece that you were contributing to EgoPsych. It's very interesting what Jerry pointed out as we were writing EgoPsych. And then we were talking together when we were there at a conference in Paris, and I said, well, this is what you have to add there. Because he was talking about the ego functions, right? Like part of what generally ego psychologists were just putting together over the years. And so now he had all the list of them, enlarged it. And then we were thinking, well, yeah, but that's like part of what the DSM or ICD anyway are now adopting, without citing, of course. There's nothing to do with psychoanalysis, right? It's purely descriptive. But this is already getting into the wider manual, let's say, or better parts of it, right? Now, yes. So, yes, there is an interaction. We just need to actually be mindful of that, and maybe that would be one of the dimensions and focus. Again, not limiting. We cannot have one focus. What seems to be emerging is that we may be in a position, because of this breadth of how we are approaching any concept, depth and breadth, right? That we actually may be in a position, kind of unique position, to again have that emerge within the concepts as a very natural sequel to this kind of a thinking. And it will then be more rich, it will be informed by variety and maybe sometimes contradictory. Again, a lot of the contradictions on a surface that become very interconnected underneath.
Yeah, I was just going to say that, in terms of, it's the application of analytic theory to technique is very important, but it's only one application. Like I think it's important to see that, I think maybe to state the obvious, that psychoanalytic theory is not the same as its application technically, and also the evidential aspects are not just about technical interventions. Like we think about regression, let's say. The evidential aspects in relation to regression as part of normal development that Anna Freud talks about, or in adolescence. A lot of those are observational. Some of them might be therapeutic, but then you apply, or what Freud described as a formal regression in dreams. There you had again evidential aspects looking at the way the dreams, followed from the manifest follow from the latent, and he had a series of arguments about that. So that's formal regression or regression in trauma, breakdown of ego functions. So the evidential aspects, I don't think we should reduce, and I'm not saying anybody necessarily said that, but reduce evidential aspects to therapeutic interventional aspects, because then you have this broader theory, and then how it's used, as in any science, I think you have a very broad theory, and sometimes you don't know, like some of the ideas about regression, I don't think Freud knew that they could be useful in treating, let's say, personality disorders, which weren't even described in his day. So I think we have to, I'm not saying it's separate, but I really think and I think the encyclopedia product is keeping that open, like the more scientific, broader aspect, right? But,
yes, and you have actually done in your work on trauma, I believe that you've done a lot.
On that sort of aspects. Like I think sometimes experience distant can have a negative meaning in present-day analytic theory, but it's an important part of every scientific theory, as long as you have the eventual inferential steps, from the experience distant to the eventual experience, obviously, even though the steps may be very many, right?
Yeah, and you know what? Sometimes it is a matter of wording, because the scientific thinking, right? The behavioral change, the operationalization, those are scientific sort of like natural science type of statistically relevant terminologies. And in some ways, when we work with an individual and when there is a, let's say, unconscious to unconscious connection, of course we are not going to be thinking surface now what is going on, how to operationalize it. But again, it is not divorced from it. It is not broken away from it. And that is important to see that there are a variety of dimensions, and this is one very important one.
It goes back to the organic experience of this material coming out. On another hand, from what you're saying, what we can look at in this regard is something that's very deeply needed, and that is a moving towards an understanding of defining the psychoanalytic process. Intervention and process. These are the things that are missing. We were in a recent meeting here in the DPE, and they were trying to develop standards.
What's the DPE?
The Department of Psychoanalytic Education. And they were saying, basically, does your institute ascribe to 3 times, 4 times, or 5 times a week? And most of the people in the room were saying it doesn't have to do with frequency, it has to do with getting a process ignited and moving.
Mhm.
I was thinking of Otto's work where 3 times a week is the top limit if you're in a severe borderline disorder. So it was the wrong question. The group was basically saying they knew that process was the answer, but they don't know how to define it.
Yeah.
And yet clinicians all over the world have their ideas about process, and this can be tapped. in
Yeah,
terms
I believe
of-
that would be one of them, the concepts that are coming up. But even just any of those new concepts, and any of the concepts that already have been actually part of the work. You have transference, you have countertransference, you have setting, psychoanalytic
Yes.
setting, right? Those are all elements or parts of the process. And now we are going towards the more technical issues, maybe, you could say, pre-association, regression, which happens and is deepening through that, and what happens with particular categories of patients during that, for instance. And that will be, and then building psychic structure. So you have a regression on one hand, and then you have building psychic structure. How do they interact? This is a very important dimension, and it is not to be approached in any kind of simplistic way. And that is, I think, that where psychoanalysis then can enrich even the field of research, actually. Because we do have latent level, many levels, right? And intrapsychic and interpsychic or intersubjective will interact. And then how does the process start, unravel?
I'd like to ask another question, because I'm very interested in Otto's idea. Otto, you have a manual already, a very lengthy, detailed manualization, right?
Maybe
You're
you wrote so many of
interested.
them
You
that
have
you
a
don't.
map.
He doesn't.
Yeah, we do.
I have a copy of
I
it.
mean, yeah.
I don't use it. I don't refer to it.
I want to make sure it's yours.
Yeah, well, also, there is a manual in Europe. There's a guy named Henrik Hamrikhausen's his name, Henrik Hamrikhausen,
Uh-huh.
who was working in Switzerland, where they have their own manual, as a psychoanalytic manual, about technique. So I'm thinking maybe as an appendix of some sort to what you're doing, you could have separate manuals from different countries.
Well,
From how they do it,
that
how
would
does
be-
Otto's group do it?
Is
How does
this-
Henrik
I
Hamrikhausen?
don't know that Swiss manual. Is it in German or
It's
French?
in I believe it's in German. His name is Hamrikhausen, and it came out a few years ago. I can't read it, but you would be able to read it. I can't read it. It's the European diagnostic or technical manual. I can write him and ask him to send it to you.
Yeah. Okay.
Yeah.
It's a manual on technique, of
I
psychoanalytic
believe
technique.
it's a manual.
First, I don't know about that.
Yeah. He's in Zurich.
All the time in Germany and
Now, he's a German guy who's trained in Zurich,
yeah.
and he wrote this manual over
And
a
what's his
10
last name?
Hamrikhausen.
Is it put together with any kind of
Yeah.
idea of research or effectiveness or results or
I don't remember.
outcomes?
Yeah, I think it was something like that.
Because, you know, by the way, we are not exactly going against the history of psychoanalysis, because Fenichel, from rather early on, from 20s, already was doing research on the outcomes, right? He was tabulating
Right, Berlin.
outcomes. That's right. They got, now, the criteria were
Simple.
variably defined, but they did have 80%. He tracked the results, and they had 80% improvement. Now, the criteria of improvement, the process variables, if you want to talk the research language, the outcomes variables, we could have issues with that, but the idea was there. Now, Fenichel is not exactly a renegade, right? it was somewhere in the back of the mind. He did the research, was one of the first actually research studies. It was in psychoanalysis. I had that in my dissertation, so you know, real. And there were a number of studies that he put together, number of outcomes that compiled, and at 80%, which of course Isaac then later on completely debunked, right?
A third.
Yeah, but there was obviously the idea. This is what is important also for us. That this is not like we are now just responding to the to this unprecedented kind of scientificism or reductionism. That it was on their mind. Yeah, go ahead. Yeah, you were thinking something.
Yeah, I just commenting on the Wallerstein project, the Menninger Foundation, which in the 1950s started out looking for effectiveness of psychoanalysis and psychoanalytic psychotherapy. And one interesting finding was that to evaluate outcome in terms of psychoanalytic principles proved impossible. Our criteria were structural intrapsychic change. That's a highly respectable principle in psychoanalysis, where id was should ego be. We couldn't evaluate it in the patients. We had books of information, but it couldn't be. We had to go back to how do they behave in life. In other words, the outcome had to be measured in behavioral manifestations, not in intrapsychic changes that couldn't be evaluated precisely. Once we looked at the global aspects of the behavior, which then eventually came the global behavioral scale and the GAS scale that the American psychiatric adopted, there we could do it, and all the findings were based on that overall behavioral assessment. Yeah. And so now we are very much advanced in how to study outcome. Outcome is no problem. We could do research any day. The problem is to define clearly what are we doing. What are our technical intervention? How do the intervention of psychoanalysis differ from those, say, of psychoanalytic psychotherapy or cognitive therapy? So you have to define psychoanalytic intervention very precisely. So when you observe the treatments, you can say this was psychoanalytic technique, this was not. And that precise definition requires a manualization of psychoanalytic technique. This doesn't mean strict telling you what to do, what to say to the patient, but giving clear guidelines that are specific to what is psychoanalysis in contrast to what is not. That's what we need.
Yes, and you know, I'm just thinking about the infant research, where they basically are tracking the minute movements, even just mimicking or gestures of those interactions between, let's say, mother and baby. So we may need to sometimes go, not necessarily to be on a camera, but to be able to track in those very microscopic ways what is going on for us and what informs actually our intervention. But I also want to say something about that, you know, talking about the research. So there's a long history. There are problems, there were problems somehow gauging and maybe evaluating or sort of spelling out in some measurable measurable values the intrapsychic changes, but we know when there are intrapsychic changes, and so then how do we know that, right? Because it is going to be coming up in the way how patients maybe form relationships, how they relate to us also, how they even think back then, how they are reconstructing or reevaluating how they were evolving or developing. And usually, as one of, talking about representation, for instance, now, next batch of concepts, usually as one of the outcomes, which is not very readily mentioned, is that there is a wider range of representational capacity. In a very kind of a general way, the patient starts talking differently. The nuances get expressed in more nuanced language, right? The black and white is not so. So there are certain, even just language, and I think certainly that French could be solved on, because they are so into language that you can track it in the way how the person expresses themselves with words and the tonality of it. There you have, of course, less than tangible measure, right? How people are also, sort of how much they think, how thoughtful they are, how nuanced they are, how...
Yeah, but you can have all kinds of development in that way, and a gap between them, and behavioral change. You said that behavioral change has been the only thing that people can point to about what is. I think that's very interesting. You know, if that's the only thing we can point to, then we know clinically that, you know, even as far back as the 60s or something, people like DeWall writing about, you know, what analysts think of and value, which is precisely what you're talking about. But the difference between that and what some patients value, you know, we know that there are patients who can behaviorally, you know, really begin to enrich their lives and not be so self-destructive, then their internal worlds, much to our frustration, so don't really match exactly what we imagine and value and so on. So
Yeah.
it's very,
I think
I
that
don't know, it's a very...
whole subject is just so multifaceted, because if we really approach it as analysts, then we are so aware that obviously the internal world and the external manifestation of it are connected. They are not disconnected, so that when we say behavioral change, well, that will always have some correlate somewhere in their, we could say, drive life or ego organization, superego modifications and all that. So, and then how they all interact internally. But, you know, the larger categories, that I was doing actually the research on those things years ago in Europe. So we had a category, for instance, insight. Okay? There was genetic insight. Then there was the there and now, the sort of interpersonal insight, and then the transference in the session, right here and now. Then we had behavior and attitudes, sort of that they might be connected. And that would be a large category. There would be a lot of very specific areas. And then symptoms, because obviously if the person doesn't like their symptoms, that will be subjectively bothering them. Although, let's say some characterological problems will be bothering their neighbor or their wife or their husband or their children, but will not bother them, right? Subjectively. So yes, you have all these all the variability of ways how to think about, but as a thought, as a dimension of what we are not excluding, rather that it should be limiting us, but that where we are branching more into and including that as a dimension. Because I think we are doing it anyway. We are not just sitting there with the patient, and we are making our minute clinical decisions based on that it would be somehow useful, right? That it would somehow enlarge something or grow something. The neutrality is essentially in terms of being on the side of a health, right? Our value.
The guy's name is Holger Himighofen, and with your permission, I'm going to send him an email copying you and Eva.
Oh, that would be wonderful.
Okay, and I seem to recall he had this.
Yeah.
I'm writing it. Okay. Sent.
You send it to
I
me
just
also?
sent it.
Oh,
Yeah,
okay,
you-
great. And it comes from you?
Comes from me.
Yeah, okay. So,
We'll see if it's the same
all
email.
right. Yeah, but the Leichsering and Reibung also from that was the German research published in New England School of Medicine on the dynamic therapies, that they actually are on par with the cognitive, behavioral, and humanistic and eclectic, right? That was the first actually mega study where psychoanalytically informed dynamic work was being credited as producing results.
That was Schindler,
Hmm?
the Jonathan Schindler.
And Schindler then still did more, kind of connected that with a lot of new studies coming from North American continent.
Well, and Barbara Milrod did a lot.
Mhm.
Richard Summers has a whole book about it.
All right, so, and there are certain categories again, right? Because they have to define then what is it that they are meaning by dynamic.
Can I have a couple of minutes?
Of course.
One of the things about psychoanalysis, which is wonderful, right? It's a wonderful exercise. I'm trying to apply it in a forensic center. I agree with you, sir. How do you measure the change? I'm working in an institution. Inmates begin to pick up my language. I change the language continuously as much as I'm able to, and they seem to follow that.
Mm-hmm.
I do risk assessment. Always I'm asked the same question. How do you know that what you do works? I said, well, the only thing I have is what I see within the group. It is a suppressing situation. You all seem to be talking about epistemology. How do we know that what we know is that there is to know? I cannot argue and say to a judge, linguistically they are wonderful. They know about their mothers, they know about their fathers, they've learned about infantile sexuality. And always the question is the same, doctor, but are you sure that they will not assault outside? I don't. And we have all kinds of statistical measurements. They're useless because they all have to do with what I see in the environment. What's missing for me is the application in forensic settings. The institute in Chicago is offering $15,000 prize for good paper on the application of psychoanalysis in the forensic setting.
Really?
I just picked it up. I would have gone for the 5,000.
I'll send
the
them the
second.
book that
It's too late. I do
Just wrote a
it.
book about pedophiles.
Excuse me?
They'd be interested in a book about pedophiles.
Yeah, but since we talk about that, it would be good maybe to differentiate between infantile sexuality and pedophilic sexuality.
Well,
Is
that
that-
would certainly go under the infantile sexuality.
So that should include regression.
Should include.
Regression. In the regression, we should have it.
So it depends how then, how it develops.
If that's a new topic, I'd like to be involved.
Yes, okay,
I like it.
very good. It is a new topic,
Okay.
yes. Yes, now, you are bringing a very important piece, also aspect again of this encyclopedic work, and in connection with what we are talking about now, that Otto brought up, that especially the relevance of psychoanalysis to applied areas, right? Where can it be applied besides our office, besides the individual work? And while this lives essentially in the, I think, cultural zeitgeist, and is evolving as part of it, and then informs it back, right? There's a kind of reciprocal relation. But there are applied fields, and this was already Freud's idea, that essentially they can enrich the thinking of the analyst, and analyst can enrich the thinking of whatever the connected field, like art, anything else, culture, society, sociology. But there are, then the more we can be specific again and sort of translate what we are talking about into, you can say either operational language or sort of a, again, language which could be then applied in variety of other fields. That would then, that would be very important. And then how do we pick that up with one individual patient? How do we pick that up in a group analytic setting? How do we then apply that and how we document? What I actually find fascinating is that the Chicago Institute actually would put the two and two together. That psychoanalysis, because it after all does deal with sexuality somehow, right? Is maybe in a good position to come up with something, but they don't have yet.
Yeah, you know, it's interesting because it's a law firm that's actually behind that prize. And they approached the Institute in Chicago and said, we'd like to get some of your thinking about forensic work.
Like expert
and they put up the money for it.
But how is all of this related to, I mean, I understand Otto's idea of technique being essential in understanding the psychoanalytic process, but all of, you know, I'm not quite sure how, unless you want to add the whole notion of forensics as another topic, how that comes into this meeting today. So,
well, we are talking about infantile sexuality, for instance,
well,
as one of the concepts coming up,
yes,
right?
yes, but it's okay.
Well, I'd like to respond to that question, though. That question seems to me to be about the method of our project.
Mm-hmm.
And it seems useful to identify a divergent and convergent phase of the work that we're doing. And that in the divergent phase of the work, to question whether a topic is relevant is probably premature. If it's a divergent phase, if we're gathering, someone suggests, let's look at the forensic implications of psychoanalytic thought. I think that what you're saying is put that in. Let's see where we put that in. The convergent functions, like coming up with a manual for treatment or coming up with any other focused recommendations, seems to me goes later in a certain conceptual phase. I don't think that should guide the gathering or the determination of the scope of concepts, you know, the convergent intent. I think there should be a phase where, if it's proposed by someone who's working psychoanalytically, as you've said, that's reason enough to try to find a place for it within the overall scope. And then ultimately, there will be work towards what's the utility of it?
Well, that's the thing, that actually now I like the how you sort of put it on that continuum, or we could take it as two opposing categories, but rather the dialectic, the ongoing dialectic, right, with the divergence and convergence. Because yes, we are starting with also Rosemary was talking about the exploratory, right? Mm-hmm. And that's where we are cautioning against premature integration. And that is right in the philosophy. Yeah, go ahead.
But I also heard that we're trying to address problems that we don't find great success in: pedophilia, predictability of violence, social violence. And these are areas that really need to find a place because we're having such trouble with them clinically.
Yes, and that's actually a very interesting, a very important piece, because if you go to, of all places, to our entry unconscious metaphysical concept, there is such a thing as a group unconscious. And
Yes.
Alana Furlong up in Montreal suggested we need group unconscious also. So we went into the category, subchapter, group unconscious. You are there, okay?
Yeah.
So, terrorism,
Yes.
we have it there.
Sanctioned social
And
violence.
now, so it was included, but let me just read it to you, look the piece, because this is actually really important. The same as mentioning the sexual deviancy with the ego.
Right.
Assessment and the ego functions, all right, and then the technique. So we are embarking on this very naturally, organically. They are already starting there. But let me just go. Where is the
I
unconscious?
have it right here.
Sorry.
Where is the unconscious?
I have it right here.
You have there? Yeah, okay. So I just want to let you know
I
the
just saw
scope.
it.
Okay. It's huge. Yeah, okay, but I'm glad that you're here. Group unconscious. Only if you look at, so we have unconscious in neuroscience also, by the way, but talking about the interdisciplinary group.
Right.
Okay. Okay. Thank you so much for coming. We'll be following up. Okay, so let me just quickly let you know what is there already, okay? Just headings.
Yes,
okay?
that was...
Just that you would know that these are already starting. And this is metapsychology. Okay, group analysis. So all right, so it starts with Freud, right? A lot of, by the way, 22 publications altogether. That 22 titles, and then of course just 3 most known: analysis of the ego, group psychology, analysis of ego, and then civilization in the discontent. It starts with the totem and taboo, and then we go into Dion, Asia, Yatkin, Kernberg, now group analytic therapies, social violence and terrorism, Otto, historical trauma, ethnic unconscious, social international crisis. There's Volkan among others. Organizational and dynamic, psychohistory. Before conclusion, that's the last chapter. So yes, that's the divergence, which is now, right now, this is the principle. So that I'm sure if we are writing on the infantile sexuality, there is going to be a place for interdisciplinary scope on that.
The application of that, if I may, it should not be just for people who are interested in analytical thinking. It should be also available to the CBT people, to whoever does whatever they does. And they should be able to reach it rapidly without going through articles and articles. People are simply lazy to read. I can see it among my colleagues.
Just that it would be
Except for the sports.
widely known. So we are talking about essentially for whom this work is, right? And even now widening the scope, because now, right now, it is on the pages of the IPA Encyclopedic Dictionary. So it's the pages of the IPA world, that's basically. Now, I will give you an example of how this is widening, all right, the whole reach of this. So about 2 years ago, the first meeting of the Encyclopedic Dictionary during APSA was in my office. There were 4 people. Okay? There was Stefano Bolognini, he was one of them. So basically, there were 2 other North American analysts because my office, so I had to be there too. Now, a year later, we had 1.5 hours. Today we have 3 hours. Okay? I imagine years to come there will be much more, even maybe the whole day conference on that. All right? But these kinds of, but this I call living room. We will decide what is comfortable for us because then we can come up with all kinds of ideas and we don't have to censor ourselves at all. It's not a matter of presenting. It is a matter of just sort of seeing where our processes, where all these associations component here, and this is like a think tank, essentially. So, yes, I believe that this is where it may need to go, right? Because there are fields where this may be very directly or less directly sometimes applicable. And certainly, we could say that Jonathan Chandler put basically the psychodynamic therapies on a map of effective therapies. By the way, and this is, we don't have an answer to that. What he found out was that something what is unheard of for any other therapy, including the medication therapy, when you end the psychoanalytic therapy, the patient continues to improve. Okay? So there's something exactly about, something specifically about the possibly internalization, possibly changing of the inter-psychic structure that makes this possible. CBT doesn't have that result, behavioral, cognitive, humanistic, all kinds of other therapies, including medication, does not have this. At best, lasting results without relapse, without worsening of condition.
Yeah,
Psychoanalysis and psychodynamic therapies, patient continues to improve.
Leo Rangel had a thought about it. He said it wasn't identification with the analyst, it was identification with the analytic process.
Analytic process, function,
That they had
improvement afterwards. Yes. Well, that would be, yeah, go ahead.
No, excuse me, I just want to go back to what I said about forensic. It's not that I'm against including that by any stretch of the imagination. I just wonder for us, you know, because this is an ongoing work, I understand, but there has to be some kind of parameter. So that's, I'm not against at all what you were saying.
I did not
Yeah.
experience it as such.
Okay, good. I just wanted to make that very clear.
I'm talking about practicality.
Yes, of course. But this is also a very theoretical. That's the thing. It's a very theoretical compilation, and I don't know if we should have just another section or another part or another volume that has to do more with like what.
No, I think that
I'm
would
talking
be
about,
a,
what you're talking about.
Linda.
There are things that are challenging to us.
Definitely.
That should be in this encyclopedia.
Definitely.
And things that challenge every therapy. The sexual perversions, the violence, whether it's
100%.
satisfying or not satisfying.
100%. But the question is
satisfying.
It's only the American
what you're saying. No.
Actually,
but
You sound like
Yes.
one.
no, I'm agreeing with what he said.
Do you understand you're saying that, because I've come late, so I didn't hear what I was looking for, but do you understand that you're saying that the improvement continues in the post-termination period?
Yes.
But what about those patients, usually a minority, who decompensate and cannot tolerate the separation? We have
Decompensation
historical-
after ending termination, after
Yes, we have two historical examples, namely the Wolfman and the Harlan.
Yeah.
Both of them decompensated on separation from Freud. So
Yes.
this has been an experience also in many institutes,
Right.
Yeah.
where at the end of the training analysis, when the candidate is no longer in supervision, and cannot lean on the auxiliary ego of the supervisor, there are candidates who can decompensate in various ways. It's a small minority, but we certainly should not avoid mentioning it. We should learn from our, our
Yeah.
misunderstandings or, let's say, unpredictable occurrences, and look backwards to see how we might have better understood the situation.
Yes, and you know what, I actually mentioned it in the context of that this was one of the improved categories. Such an improved category did not exist in any other therapy, but in analysis or dynamic therapies, where the insight was part of an exploration of the transference relationship was part of the process. So it would be among the improved ones, right? But that's how it was counted, and they were comparably, it was a comparable distribution along the curve with other therapies. But this particular improvement category was unique to psychoanalysis and dynamic therapies. It did not exist as an improvement category among those who are improved, not those who are decompensating or not improved. But that was one of the improvement categories which were not found in any other therapy. That's what was the
And the two things may not be unrelated anyway, because the depth of therapy and the regression that tendency for some patients to decompensate after the end maybe related to the same process that leads some patients to improve after analysis. Right?
Well, I think my own way of thinking about it is that there's a potential, if there is structural change during analysis, that people will be able to withstand the slings and arrows of life more successfully. But I think it's that we have so many, I agree with Harold, it's not just Freud's cases, but all of us have had cases where years later there may be some trigger in somebody's life that causes illness again. I believe there was a study done some years ago of kids who had been analyzed as children, and then they were reanalyzed as adults, and because they had new problems as adults. And the one thing that carried over was the analytic capacity, the capacity to think about themselves. But there were new problems that developed at different stages of development, and analysis is not a prophylaxis for that. So, but what you're saying is that it can be, and when there is structural change, there's a better chance that somebody may handle things better, and that is different from somebody who's taking medication. So
I would imagine also that there are situations where we miss something, right? So if we are analyzing somebody as an essentially neurotic character, and then it turns out that he may not be, there may be deeper problems like with Wolfman, so maybe we would not quite approach it in that way. As Brunswick then approached it differently, and she got a different result. So, but with Wolfman, there's a very specific issue of a kind of today more borderline-ish, right, personality disorder, while the interpretations with Wolfman were very much around the phallic issues, and they obviously were not French, talking about French, actually would say that Wolfman did not recognize his internal life as his internal life. You know, like he doesn't recognize when he hallucinates on his finger that it is actually his own hallucination, because he thinks that the finger is gone. And it's not his finger to begin with now anymore. So there is that's what the French would say, that there are those who have internal life, those are neurotics, and then those who do not know that they have internal life, and they would require different analytic treatment, but it's the analytic treatment of a different kind, it's the unsymbolized. But I just want to bring something to our attention also, talking about how do we actually, are those concepts theoretical concepts, or is there room for more also maybe thinking about variety of application or applicability in different fields or interdisciplinary areas. So I tell you what is the general, just kind of remind us, to bring us back to the general way of the outlines of those concepts, right? So that might help so that we know where and if, yes, there is a place for these expansions. So for instance, we do have at the beginning there is an introduction definition, or sometimes it's like an introductory definition. That would be actually, if we were to write a dictionary, that would be the terminology, that's the term, that's the concept. And that's where it might start, okay? There's an introductory definition. And that is taken from contemporary dictionaries all across the continents, okay? Then there, because this is an encyclopedic dictionary, then there is a historical subchapter, okay? Historical beginnings, which may start with Freud, but may go into kind of prehistory, how these concepts started evolving, maybe even in philosophy, etc. Then go to beginning of the interrogation of a particular concept from different psychoanalytic schools of thought, which are then relevant, also wider social, cultural, philosophical context sometimes. Then contemporary exposition, the third would be contemporary exposition or the kind of a post-Freudian period, let's say, post-classical period, and going into contemporary exposition in various schools of thought and contemporary clinical usage. Okay? So in the contemporary clinical usage, there is a room for applications in variety of clinical settings. Okay? Then there is a conclusion, and then, which by the way is the conclusion, in a way is different than the introduction, by the way, because something happened in the meantime, in between, right? So we now have some new knowledge how we put maybe the term, as it was more narrowly defined at the outset, into more broader, a broader context. Okay. Obviously, if it is tri-regional, then there will be tri-regional references again, because each region may have arrived at something different. And then there are references, then there are contributors of everybody who participated, who in any which way contributed to the draft. So this is described actually in the methodology portion, okay, but it applies to both. It applies to the interregional as well as intraregional. The outline is a basic structure which starts with the definition, goes into the history and the roots, and then goes into contemporary schools of thoughts, exposition, as well as the clinical usage. And the clinical usage then do expand often into, where pertinent, into variety of areas how it is applied. Now, of course, the clinical usage also, back to Otto's issue, or your point as you brought it up, clinical usage also involves or could include, has there been any research done on this? Are there any maybe findings in particular type of applications, maybe for a particular population, and in particular continents, right? So that it can expand into anything relevant. For instance, when we were writing on containment, which you have here, one of the first ones, it included also the application within child analysis and within the work with the work with autistic children. Dustin did with the autistic children, right? And using the concept there, which would not be the general adult psychoanalysis as we would be thinking of that. But there are the group, children, and variety of populations. That is where then if it is forensic population, if it is any other population, within industry, that's where then all these expansions go, right? And I think it is actually very important that we are taking this broad and depth perspective, because then we are not reducing anything. It might be hard case to make that if let's say a certain research should be a certain evaluation of technique, standardization should come out of this. It would be a hard case to make that somehow we are reductionistic, because if anything, we are so expansionistic that Linda tells us, so how does that, where does that fit? How does that relate to what we are doing? So obviously we are pushing then we are going right up to the edge, where the applicability might go. And then of course we may need to go for some standardization at some point as it organically emerges from all this variability and diversity. How is it for you to enter now, because we are in the middle of that? There was this big discussion on...
It has its difficulties. I'm sorry I have been in another meeting, as you know, but I am concerned about another aspect.
Yes.
I thought about this too. There is something, a contradiction in terms of the very title, Encyclopedic Dictionary.
Yes.
We think of a dictionary as concise,
Yeah.
and encyclopedia as much more expansive and prolix.
Yeah.
So, there's a choice here of how far you go and who will the readers be. If they're looking for a dictionary definition, they're looking for something concise, laconic, and very much to the point.
Yeah.
In an encyclopedia, they're looking for something very expansive. I think there might be some thought, considering the reader and the audience, about you have no limit. I noticed you said there's no limit. I think the editors ought to exercise some limitation, because otherwise the readers will be turned off.
Yes, that's a very good point. You see, now the explanation, of course, is in terms of what I was saying before, that the dictionary definition is the introductory definition. So if somebody is interested in dictionary definition, they read the introductory definition. That is where it is. If somebody then is interested in the encyclopedic part, to go really into this, what has not ever been done before, to kind of pull out together and represent as fully as possible all the continental cultures, all the schools of thoughts, all the possible, not just thoughts, schools of thought, but also clinical usage, maybe in with variety of application areas. Then they go into the larger, but you're right, we do have a limit. It is 75 with the literature. So for instance, now we are getting, which was set up, it is again organically emerging, all right? And these as coming from three continents, you have to consider all three writing, right? And you have to merge that. What is redundant outright, you basically merge. What is not relevant, you don't put in. But other than that, you usually do preserve the texts, because it does offer what nothing else before offered, that there is this chance to see the whole variability. But 75 with the literature, often, and that's the unconscious, okay, it does have a limit. But if you consider all three continents and everything that is relevant, thought-wise as well as clinical usage, it's not that much. But if somebody wants to, by the way, this was from Psychoanalytic Institutes, one of the feedbacks, I told you we would be talking about feedback also, one of the feedbacks was, can you do students, candidates, right? Europe, no, Italy we are talking about. this is like a cathedral, first of all. Complete like adoration, right? It's like looking at the cathedral. This is incredible. And then, after a course, well, can you do it a little bit simply more? Give us just more simple, like 1, 2, 3, 4, 5, right? So, and can you do each of those into a shorter version? So, now to which we are saying no, that is not possible, okay? It's not our job. This is an instructor's job in the Psychoanalytic Institute to basically select the material, to give you the particular readings, to instruct you how to approach this so that you get the most out of it. But if the issue is to have it simply defined, that's the introductory definition.
Have you thought about the possibility, I mean, this is maybe in advance of, but the possibility of extracting the dictionary introductions and having them as a digest dictionary? It's very easy now in publication to have both the expanded encyclopedia and the dictionary version, so it's available for both. I mean, I think the encyclopedia shouldn't be compromised for that purpose, as you said, but there may be people who want that dictionary as well. And since the data would be there.
Well, that's where, yes, and I'm sure that you could do that, and then you would have to then you would read that part, and you could bind those together.
Yep.
But if you look at some of these concepts, then what you also have there is from all 3 continents, this is put together into the dictionary, into the introductory definition. And so that is there, so that those are the known dictionaries from those continents. And then there is a conclusion, which is a newer kind of engagement after you went through the whole encyclopedic titrating of the concept. Then there is a conclusion where it already is put together differently. So now you would have to bind the introduction and then the conclusion. But then who did not read in between is going to have a tough time doing the conclusion. But certainly just that would be possible to do just the introductory definitions. But people can just always read the introductory definition. That, by the way, could be an instruction to readers. The introductory definition would be the customary exposition of the term, the defining of the term. But that is the dictionary portion.
Do I understand something correctly? You're going to try to take definitions from 3 areas.
From 3 what? Continents.
Continents. Those definitions that are similar, you will combine and call them a tri. Right.
I can read you example.
The tripartite. Actually, combine them into one definition.
Yeah.
But the definitions that don't combine, you're going to keep separate.
Yes.
From the different areas.
And
so you're going to have
people.
Here are the generally agreed upon things, and here are the things that are not agreed upon.
Okay,
right?
now I will just read you example. Where do we have enactment? Because there it may be most easily. Do we have enactment somewhere?
Here it is.
Okay, great. Thank you, Joseph. Okay, so I'm going to read to you. Bear up with me so we know what we are talking about. Okay, introductory definition. Sometimes it's called introductory, sometimes it's called introductory definition. So if we talk about enactment, this goes to, pages, 2 pages. And I will just say the main thing, so I will cut that down too. The concept of enactment does not have a stable place in psychoanalytic theory. This is the beginning. Uses of the term vary very widely from continent or from confinement to the analytic situation to a broad range of interactions and behaviors in life. Following the first use of the term in the title of a paper by Theodore Jacobs, enactment has often been thought of as a North American concept. However, in contemporary North American psychoanalytic literature, there is no single concept of enactment. Rather, there's a group of such concepts. Now, Akhtar is also cited there, and now we are Akhtar's dictionary, and we are proceeding according to Akhtar and Hocking-Kloss and Sundberg, right? What they are: transference, countertransference, enactment, citations, explanation. The analyst's unconscious induction of the analysant's unconscious induction of the analyst to live out the analysant's unconscious fantasies, akin to projective identification. That's 2. 3. An embedded series of often subtle unconscious interactive mutually constructed dramas that are lived out, etc. And then any dramatic expression of transferential, countertransferential rupture, Elman. That's North America. In Latin America, this conceptual plurality has been reduced owing to the additional historical influence of authors like Reker, Greenberg, Baranger, blah, blah, blah. Now, their definition will be the predominant contemporary understanding of enactment in Latin America concerns phenomena where the analytic field is invaded by discharge and or behaviors that involve both patient and analyst. Enactments arise from mutual emotional inducement without the members of the analytic dyad clearly realizing what is happening. Enactment reflect back to situations where verbal symbolization was impaired, and when words are available, they are used in limited and concrete ways. All right? So that would be the example of how they reduce that. Latin American. European understanding of the term is closer to the Latin American than to the North American version, because the concept is rather exclusively confined to the analytic session. However, for some European analysts, it differs from the Latin American version in that enactment is not so much a co-creation of patient and analyst, but rather the result of the interaction between them. Now, that is explained later on what is meant by that. The references to enactment being positioned within the countertransference or acting out are fairly common. For example, European example of something rather specific, Steiner's view of interpretative enactment, which is not in any of those, now this is different, right, specific to Europe, is about the analyst's verbal communication, and is the idea that you though offered as interpretation, the uterance expresses the analyst's countertransferential feelings and attitude. Okay? So then the conclusion to the definition. The prevailing view of enactments in relation to psychoanalytic interpretation within all three continental psychoanalytic culture is that whatever the formulation of the underlying processes and contents, enactments as they relate to the psychoanalytic situation are seen as developmentally and or dynamically meaningful, and they need to be understood and ultimately, however gradually and in an individual version, interpreted. So there's a firm statement. It will need to be interpreted, but it can come out in all those kinds of... So this would be an example of an introductory definition where you have different approach of all three continents and whether they are summarized in terms of differences and what is common. Okay? It's interesting that the interpretation prevails even with enactment. Okay? That is common then. That is the most frequently occurring field. So that's where the dictionary would end. And then you have, and this is one of the shorter ones, then you have background in Freud, even for enactments, we have background in Freud, development of the concept goes from there, and then you have North American evolution of the concept, additional influence of the British object relations, Latin American evolution of the concept, wider context and conceptual precursors, contemporary developments and uses of the concept in the Americas and in Europe. Okay, there you have the Latin America developments and clinical relevance. North American developments and clinical relevance. And then you have a conclusion, which I could just quickly read to you to gauge the difference between the dictionary definition right at the start and then what they come up at the end. They, us, okay. Sorry, there was actually Rosemary was on the intra-regional, but there were many people on the regional draft. So, I probably have a better glasses. I must have better glasses because these are atrocious. Okay. Okay, this is much better. Sorry, I was like stuttering before. Conclusion, slightly different. When the analytic dyad, and this goes directly already, basically, this is what the team now came up with, okay? When the analytic dyad gets dramatically destabilized, acute enactment, this may indicate that a previously chronic enactment was undone and is now active within the analysis.
Is what?
Was undone and is now active within the analysis. The analyst needs to become aware of this state, attempt to understand, and then interpret what has occurred. The analytic field can be destroyed if this is ignored or the chronic enactment return. Additionally, the analyst can identify further aspects of chronic and potential acute enactments by taking a second look when he or she writes the material, rethinks it, or discusses it with other analysts. Enactments carry potentially significant developmental and dynamic meanings. Listening to, working with, understanding, and interpreting enactments can minimize the incidence of unsymbolized somatic expressions and or acting out by the patient in his or her everyday life. Doing so may lift the burdens that the unremembered and unforgotten events, happenings of infancy and childhood, including those transmitted transgenerationally, impose on the patient's current relationships and involvements in their life pursuits. Analysts may also better apprehend from a position of empathic understanding what a patient has lived through, thus deepening and widening the scope of transformative, emotionally meaningful psychoanalytic experience for patients and the analyst's own multidimensional involvement in the psychoanalytic process. While the prevailing view, this is the last, among all three continental psychoanalytic cultures is that enactments are to be understood and ultimately interpreted, it is very important to be mindful of the existence of the type of countertransferential enactment where the analyst's diminished analytical capacity for containment can be communicated not only non-verbally but also verbally and disguised even within an interpretation. So, it's somewhat different, right? The issue is then what you do with, obviously something transpired in between. And that's the evolution, that's the encyclopedic working out and inclusive working out of all the applications, all the technical parameters, because that is there.
There might be a statement as part of the integration of the concept, and it seems to me there's general agreement about it, that enactment is a practically unavoidable aspect of the emergence of an unconscious problem, of a past internalized object relation, and that it is a process on the road to understanding.
Yes, absolutely.
And that it needs to be differentiated clearly from acting out.
Yes.
Yeah.
Which
that's the European, and that we actually, because it has a negative connotation, right? enactment is essentially any transference because
Right.
yeah.
Well, it's more than that, and depending on how you define it, we looked at a spectrum of interaction that had acting out on one end, which was the patient's wishes and fears generated, transference actualization, which was the patient's involvement,
Yeah.
enactment, which both included both the wishes and fears being gratified for the therapist, the analyst, and the patient, and then countertransference actualization and boundary violations. These are all very different, but they share a dynamic of who's getting what and who
Right.
wants what, and I didn't hear that in this.
Well, you wouldn't because you just heard that. That's the problem. That we then lose that. It is all there.
Yes, it's true.
But it is, that's right,
It's all
it is
being
all
regulated.
there, but that's where you do need a wider exposition. Because you are just talking about the
Spectrum
kind of North
interaction.
American spectrum, right? And still don't completely include, let's say, even the relational views of the co-creation of everything.
They're included. That's
All right,
just,
but that is there, and that's only the North America, okay? Now,
Yeah.
the Latin America is putting a great emphasis on the archaic and sort of that basically the language is not capable. It's not on the stage of development as far as that particular area goes, a particular emotional area, which is getting involved between the two of them, the duo. And that's where they are more interested in the kind of an archaic notion, and then how you are emerging from that and how you build from there. And they are the ones who are dividing, that was Casorla, dividing the chronic and the acute, and that the acute are actually not to be let to be chronicized because they very easily just slip, and then it goes into more kind of malignant forms. And the Europeans are very much about acting out. Okay, that's where the concept of enactment did not come out as a very prominent concept. That was their prominent was North and South America, Latin America. So Europeans wrote the response draft, and they did not include certain parts which did not quite agree with the mainstream thinking of the acting out. So we reminded them, and that was where then the French concept of the French concept which was not translated into English, which was
That's the passage à l'acte.
what?
This is the French passage à l'acte,
No,
which is a
it
distinction
the,
between acting out and
agit
passage.
partagé. It is
Well, that's
basically
different,
the
but-
shared acted experience.
Yeah, but there's also something called the passage à l'acte, which Lacan distinguishes from
All right.
acting out. yeah.
That is there too, but
Yeah.
that was included, but the other one was not. The l'expérience agit partagé existed as a isolated, as an isolate, all right, a Belgian psychoanalyst, never translating anything into English as far as that goes. And there actually is a certain manual on 40 pages. They describe how you then start working with it to bring it into a symbolizable and symbolic area. Very interesting, 40 pages of French. I actually read it, and I told these guys who did not include it, no, you gotta include this because this is very interesting. Besides, it kind of opposes the acting out, and so already because of that, it is important to include. So then we had a back and forth. It is included there, but you would not know it from reading just the introduction and the conclusion. That's where then those pages come in. This is one of the shorter ones.
But if you distill out what is common, it would be an interaction between analyst and patient that has unconscious meanings that are
Yes.
not being understood at the time.
Yes, and it is a
Then you can
transference
have
from
40
to
pages of
transference.
French.
40 pages French doesn't mean, okay,
I tell you how, this is one of the, look, you would like this, by the way. You would like this. This is only, you see, there's a lot of literature also. Literature covers sometimes 1/3. Because that gives you really the widest,
It's
then
what
people
you
can
want
go
from,
into it.
from an
right?
encyclopedia. I mean, if you're using an
14
encyclopedia
pages,
as a
Howard.
research document,
You would
you
like
want all the
that.
records.
14 pages.
Right. What you're saying is you want to also be able to get a quick definition.
Well, that's the way I write, so I'm projecting myself.
Well, he tells you that, but this is very funny. Because, let me tell you something. So, yeah, very short and concise and da. On the other hand, when we were writing ego psychology, look at how many pages there are. And I was shortening. I'm usually the guy who is shortening everything. Jerry, yeah, you've done just 1, 2, 3, 4, 5, 6, 7 pages of ego functions. But it was important, because he did the expansion version, right? Published also, so it was important. And then exemplified, and you have all the manuals there, right? And you have how it works out with the sexual offenders, how it works, what happens with the superego, how it gets manifested, how and when it does make sense to work with it, how it doesn't make sense to work with it. For instance, your work is unique because what you do is, this is an intense group analytic work. They meet 4 times a week? 3 times a week.
I continue to meet 7 days a week with my own.
Mentally anyway, and they do too.
I hope.
They do, well, they tell you, right? I'm supervising that, and it's a fascinating work, where the thinking, the kind of symbolization, that makes a lot of difference. It's an ego work from ego psychology. It's an internalization of you, essentially, new object, and they are starting to think differently.
Eva, what happened to the term acting in?
Yeah, Cecilia Paniagua is
Yeah.
writing about it.
Enactment is.
Acting in a
feels
negative
like,
acting.
Very similar to
Very
acting
similar.
in.
Is there
Very
any
similar.
discussion of this?
No, well,
That's from
in
Europe.
this it is,
Yeah.
in the enactment, but it's
Enactment.
probably shorter, unfortunately,
Right.
although that's one of the objectives. It is in as one of the developments of the enactment, one of the possible propositions. Here you have the acting out or acting in is already in the definitional, because the Americans like to do 1, 2, 3, 4, 5, right? We have several of those, yes. Yeah, but that in and of itself is not a concept as such. And I think you brought it up last time, and since you are bringing it up repeatedly, we could also include it as a conceptual base, and we will get to it then.
Because I think it's significant if the major part of the enactment or acting out, whatever we call it, is outside the analytic situation.
Yeah, that's
And
more
that would be an
resistant.
important distinction with some of the Latin American colleagues, where the only thing that's important is what they see inside
Inside,
the
yes.
analytic situation.
Yes.
As if what's happening outside and acting out with one's spouse or one's children,
Yeah,
or the patient who has an affair and acts out the erotic transference outside the analytic situation.
yes.
So that's one aspect that I think really needs to be.
It is, and I think that actually is not enough picked up under the category of enactment.
Because most of the enactment discussion is really about the unconscious interaction that Jerry was referring to. And out of the interaction in an ongoing way, microscopic or macroscopic in the analytic situation. But a good deal of enactment or acting out, whatever we're going to call it, occurs outside the purview of the immediate analytic situation.
The extra transference, extra
Was it acting out
psychoanalytic
of the
setting.
transference, or maybe referring to my own work?
It may be transference, but just acting out of
Yeah.
transference. Oh, there, yes.
So I think that's very important. The other thing I want you to know about is what about those chronic enactments
Yeah.
which are not analyzed?
No, that is what is the feature of that. Then there is you could, within the enactment category, that would be all there, because Casola, actually, the Latin American analyst, has his whole area based on that. That's what he's dividing it into. Acute and chronic, and then how you analyze it, and the acute actually become chronicized once they are not analyzed, meaning the analyst is involved in it in such a way, it could be a narrow area, it could be encapsulated. The analysis can seemingly proceed, that's the worst, that's hardest to identify, because the analysis seemingly continues to proceed in other areas, but then there is still this, what I think Barangers then might call the kind of a stalemate in that fortress, in that particular bastion, in that one area. But you see, through all this and through these discussions, we also are getting much more nuanced, because you can have a multitude of transferences, multitude of areas of enactment, in, out, resistances which already become stalemates or fortresses. And otherwise, the psychoanalytic process can also be going on, and that would be the milieu for chronicizing certain encapsulated area of enactments. It becomes chronic and therefore less analyzable, because it is not acutely experienced by the analyst, and the patient is not inconvenienced, because the patient actually is generating it originally out of their needs to balance something within themselves what they cannot contain. So it becomes a very, very important, potentially destructive area to the process.
But it's also important that you just defined it as a move from acting in to transference actualization. And so maybe part of the problem is that it's a term that has morphed in a way.
That is what is done in that long part. You see, those are the kinds of discussions, how the terminologies can get translated or mistranslated sometimes. Very important point. And that exists within each concept, actually. Hello! Oh, I'm so sorry. No, you should go. You sit right there. Hello. Thank you so much for coming.
Coming for the...
I know, but still, I understand.
Kind of brief.
Oh, what did I...
Okay. Oh, this is a camera.
No, it's not my camera, but it's
It's the camera which is now being...
we're just taking the, it's
Taking
just
the-
the cord,
yeah.
this cord just, yeah.
Thank you so much for coming. You are quite a... You don't see times. Yes? You are running around.
Yes.
Going to where I live, yes. I know, it's really wonderful.
We just wanted to say hello to everybody.
Please do.
Qué bueno que...
Very pleased to have you
Qué
on board.
bueno. Qué suerte que nos vimos, aunque sea
Sí, sí.
breve.
No pude ir a Buenos Aires,
No,
estoy
yo
muy contento
sé,
de
yo
poder verlo
sé.
aquí.
Sí.
Yeah, it is a
Como
very
sabes,
wide
estoy
and
muy
and
envuelto en
actually
tratar
high.
de mover
We cannot be
educación
more grateful
psicoanalítica
to actually
e
the people who are
investigación.
implementing our work from we've seen.
Educación, investigación y la incorporación de psicoterapia psicoanalítica dentro del Instituto
No, some different, but it's okay. No, I'm sure some of them I think are better suited than others, so I'll,
It's good to see you.
No, it's nice to see. I'm very happy.
I'm sorry, you are.
I asked them to make a statement, okay? So Virginia, Ungar, and Sergio Nick are going to tell us something about how the
So
current
I
board
left
is.
my badge because we are on our way. In the afternoon, we were leaving back to our homes. I live in Buenos Aires, Sergio lives in Rio de Janeiro. We are the president and vice president of the IPA. What I wanted to say you first is thank you very much for the work you are doing. This is a very important project, and we are, of course, we not only support the project and we will continue supporting, but also we have to thank you because it is a very good, work you are doing, you've done, and you will do. One of our
aims, we have some new projects, but is to enhance the relationship and to improve even more. I think it has improved between the IPA and the regionals, and with the membership. We created a simple motto: one IPA for all. So we know and we are aware that the communication is a problem. But it's not only communication. The IPA can be seen, and I know this, I learned from experience, quoting Beyond. Because for some people, we have 50 committees, 600 people, IPA members working. The Vice President knows better the figures. But for some people, IPA is a distant thing, remote place, many members and candidates don't know what the IPA is and what the IPA can offer. So there is a document on our website. Our treasurer, Andrew Brook, started to answer what I see. Maybe Otto, you were present. What does the IPA give me? Why should I become a member of the IPA? So Andrew started to build up a document with 16 first answers. I invite you to go to www.ipa.world. This is the world. It's not more UK how it used to be. So it's world. So world, like the world. IPA world. This is our
Because it used to be UK.
Yes, it used to be UK. Yes. So please go there and check, because I think that they are good answers, but we need to add more answers.
If I may interrupt, one of the answers is the Encyclopedia Dictionary.
The Encyclopedic Dictionary. What does the IPA give? One of the answers, you are right, is you can access the Encyclopedic Dictionary.
Yeah.
So this is the kind of project that is a high-level project, because we know how hard you work and the level of the contributions. But the most important thing that, from our point of view, is that this is an inter-regional project. So we can interact, we can discuss, we can have a dialogue. This is what we want, to enhance the dialogue and promote a dialogue. This is a scientific dialogue, and I think it's a high-level dialogue, because the contribution, as far as I could see, are excellent. So what we wanted to convey to you is our thank you to all of you and to all the members that are involved in the project, and to congratulate you, because the entries I was able to read are excellent. And I think that it will, so it's not, what I see is not only what we call the fundamental concepts of psychoanalysis, but also concepts that are being used, even words, used, and that they need a clarification. What do you say when you say this? So I think that it is a very important project, and we are happy that you are volunteering, because, and we have to thank you because of,
He's going to break it to us later.
Well, also, like, people were asking me how much I'm making out of that, so it's like, nobody gets
Okay, we can deduct, I could deduct for my salary. I have a high salary, a salary. Otto Gante.
So if you have any questions, we will be
Yes.
happy to answer.
Well, I actually also wanted to thank you very specifically, both of you, because I saw you at the beginning when we were in London, when we were introducing to you the encyclopedia, and you were paying so much attention, and you were asking all these questions. And I know that somebody then got worried. It's like, she maybe is not supportive of it. No, I said, that is the mark that she is supportive of, because she wants to actually know it from inside. And so she wants to understand, and then the support is real, right?
Yes.
So, but you were so like, and this, and why this, and why, and it was very important so that we could then have a dialogue about it.
I have to tell all of you that we worked a lot. When we were elected, we had 2 years. So we worked a lot, at least for the last, 1 year and a half, we worked a lot going through all committees, asking, contacting people, how are they feeling, if it is good. So I think that now we know about, I cannot say in detail, this is a project that I'm interested in.
No, and it was very clear, because in my mind, you would not be asking all those questions, and you were stopping me in the door and saying, how about if we call it this way or that way? You were really putting your arms around it, and I so much appreciated it. Because I did not take it as maybe they don't like it. I took it as they really want to understand what we are doing.
This is our way.
Yeah.
And
this
now
is
we
exactly
are trying
what we
to
are-
spread translations. Into
Yes, and that's-
Japanese,
That's right. And something else.
Chinese.
Yes.
Yeah, Chinese.
Yes. Portuguese, I think.
Portuguese,
Yes.
Italian.
Italian.
If we may, we will spread.
I think it's wonderful, because that's one way, that's one way, the translations, and then the other way, of course, is generally that people would be really talking about it and would have access, and that they would find it useful also in interdisciplinary, other connecting areas.
And
so that it
if,
can,
if you need something from us, just drop a line, and at some point we will answer. I cannot promise that
I
we will
know.
answer.
At some point. No, you are very good at answering. By the way, I really want to thank you both.
Thank you so much.
Thank you so much. And through you, give our thanks to all.
To everybody who could
all
be here right now.
everybody
Yes.
who's
Yes.
collaborating.
Yes.
So thank you very much.
Thank you.
Thank you.